Okay, welcome back, everyone. Today, I have the pleasure of talking with Dr. Catherine Taylor, an amazing mom of 4 children, including a set of twins. And in her free time, she just happened to get a master's degree and her doctorate degree in clinical psychology. So we are so happy to have you with us. And thank you for taking the time out of your very busy schedule to be with us and talk.
Thank you so much, Pam. I'm so happy to be here and happy to talk to everyone too.
Great. So we had the parents and the expectant parents did watch the video about possible postpartum complications in the class before our interview, so they have a little bit of an idea of what we may be talking about. And can you just tell us about your postpartum experience?
Sure. So I had my twins about 6 years ago, and prior to that, I had 2 daughters. They're singleton pregnancies. I had really normal deliveries and recoveries with them. So I had a really smooth pregnancy with the twins as well. I went all the way to 39 weeks and 1 day, which was pretty much as far as you can absolutely go with twins. So I didn't know a lot about complications. I didn't really even know quite what to look for. So I went into the births, and the doctor had recommended me for a vaginal birth because I had 2 successful vaginal deliveries, and the babies were both head down. So I delivered in the operating room, but anticipated a vaginal birth. My daughter, twin A, came out within a few minutes vaginally. But when I went to go push twin B out, my son, we started to hit some complications, and long story short, we had to go into an emergency C-section. So, the recovery from that, both a vaginal and a cesarean delivery, was obviously a lot and not something I quite knew how to wrap my head around and anticipate, and especially because I was coming home to, 4 kids, 5 and under. So it was kind of a lot to take on. And but my recovery process in the hospital was pretty normal, I would say. I went, stayed the average 4 to 5 days after the cesarean to, be monitored and make sure everything was okay. I did have a hemorrhage during the birth process, like when the placenta was coming out. So I was aware of that. But other than that, I was just kind of told the standard, if you're bleeding, call us and whatnot. So I didn't really know what to expect. So I went home, had the first night at home with the kids. And then the next afternoon, I was actually reading to my oldest daughter a book on the couch. And I remember reading to her, and I started to feel like I was losing vision on the right side of my eye. And I kept seeing these flashing lights, and I couldn't see the words anymore. And I'd never had that experience before, and I didn't, really know what was happening. So thankfully, Pam, you were there helping me take care of my kids. And I just remember going up to you and saying, I think something's wrong. I can't see. I was not smiling, though. I had a look of panic on my face. And
Neither one of us is smiling.
I was like, I can't see the pages. I can't see the words on the pages. I'm having trouble seeing. So Pam was, very calm, told me to go ahead and lay down. Luckily, knew or had a suspicion of what was going on, and had sent my husband out to go get a blood pressure cuff from Walgreens, which was down the street from us. So I was laying on my bed, and Brian came back about 10 minutes later, rushed in with a blood pressure cuff. And I just remember my heart was racing, and I was still having trouble seeing, and I got clammy and just wasn't feeling, I knew something was wrong, and took the blood pressure, and it was very, very high. I mean, I think it was 180 or 90 over 200. I mean, it was really high. And remember, we called the doctor, Brian called the doctor, and the doctor said, if you have to, drive on the side of the road, but get down to Northwestern. And so, I headed down, and they readmitted me to the hospital. And, upon further evaluation, they wanted to make sure something wasn't going on neurologically. So, I did MRI and CT scans, and they did a bunch of blood work and stuff, but they diagnosed me with preeclampsia. And I said, I thought that was only during pregnancy. I didn't realize it was something. And they said, no, it can happen. And I forget the exact number, but I want to say 20 to 25% of cases can actually happen post delivery, which I wasn't aware of. So I stayed in the hospital a while longer. They gave me a magnesium drip to help, vasodilate and, get everything going. And once I was able to get my blood pressure regulated, they sent me home on blood pressure medications. So I had to, keep that under check. And then I went in once or twice a week for a while. I'd say for 3 to 4 months for blood pressure checks, because it would occasionally just start spiking again. So it would just sort of similar situation where I would be completely fine, and then all of a sudden it would kind of go back up again. So, but there were a lot of silver lions in it. I really learned, I learned a lot about recovery, and there were things that I had not experienced in my previous pregnancies that I started to learn about and understand. And I really also started to learn how to, as a clinician, I knew how to talk to people about mindfulness and, staying calm in a difficult situation. But it's another thing to really have to apply that to yourself, especially while you're busy trying to take care of kids and figure all of that out. So there were a lot of tips and techniques that I learned to really get that help, and that I needed to kind of let my body and my mind recover from everything I had gone through. So I'll pause there and see if you have a question, and I'm happy to keep talking too.
Oh, sure. Well, and that is the problem, one of several. You're a very educated mom, a very educated woman, and you didn't know that something like that could happen when you got home. And, when we all come home with the babies, all the attention focused on the babies. Is the baby okay? Are they eating enough? And so everybody seems to kind of forget about the mom. And, well, her work is done, she's fine. And so what I was finding, over the years, especially after your situation, that so many new moms that came home had no idea about the complications that could happen once you came home. And it was really scary because, you being very educated and already being a mom, makes me even more worried about, maybe moms that are not so educated, first time moms, moms that don't have support. And they're seeing things, but they're, oh, well, no, it's nothing, it's nothing. Because I even remember very clearly you saying to me, I think I have a migraine. I'm going to take an aspirin and go lay down. And me saying, no, you're not. And you're like, why not? And so, it just worries me so much that, since then, and we've had so many moms that I've talked to that, don't know that you can have postpartum preeclampsia, don't know what to look for, headaches, blurred vision, upper right sided, upper gastric pain behind your ribs, dizziness, even, subtle things, just lightheaded. I mean, yours kind of hits you like, okay, yeah, I'm sorry, this is not a migraine. We're not going to give you aspirin and pack your head with ice. If the blood pressure cuff comes back and you have low blood pressure, okay, but we're going to make sure. And, there's just so many moms that don't know. And that's what really worries me. And, that's why, we've been doing videos, we're doing classes, we're trying to get the information out there. I'm going to be working with doctors to try and visit new moms, do nursing new visits, even if it's just for one day when they come home from the hospital, so that they do know. And I know there's so much information. When you're pregnant, you're reading all about, what to expect when expecting, everything to happen, what should you do? And then you're trying to read all these baby books. If it's your first baby, how should I take care of this baby? And you really forget about that. In a lot of cases, you have been through a vaginal birth and major surgery. And then you come home and, you think you're going to be able to just throw in a load of wash. And, so many people don't take the time to take care of themselves. And, it's so true now more than ever is, none of us have our village anymore. And, you were stuck with me. You can't get rid of me. I'll always be your village. But most of us, we don't have any village, and we don't have older people to talk to and people to help us. And so there's so many moms out there that are alone. and just trying to do the best that they can. And so that's really what worries me is about all moms, because obviously you were in a totally different situation. You had a great support system, you had experience, you had education, but yet you still were never told that this is something that could happen. So what
Yeah,
do you
so
think during your pregnancy, during your pregnancy or during your hospital stay, what do you think could have been done differently to have, helped you to be so much better prepared for this?
yeah, I think that's a great question because when you're pregnant, you're really thinking so much about the baby or baby's coming, and you're sort of in this wistful time. And I almost feel like I would have really liked to know this information during my hospital stay, like when they're really telling you like these are the things to look out for, to really hear it from my doctor, when they're doing those checkups and stuff, because that's the time you're sort of thinking about, okay, what are the things I need to know about? Because you're learning not only about the baby, because the pediatrician will come in and teach you all the stuff that you need to know about the baby and the cord and what to look for, but you're right. They don't really always pay a ton of attention to what the moms need to be looking for. So I really had no clue that preeclampsia was something that could come afterwards. So
Right.
I think really listening to your body is really important. Like I look back on that and I think to myself, my body was sending me a ton of signals, but I kept chalking it up to, oh, well, I just, had a baby. I kept chalking it up to all this stuff versus like really asking those critical questions. I also really wanted to be there for my kids and sort of be that mom I envisioned in my head versus being able to say, I can still be that mom, but also be able to say, I need to attend to myself and my body and the things that I need to do to like help myself heal.
Yes.
So I think that was a huge learning for me. Like I always say, like I always try to find the silver lining in challenging situations. And, this recovery took me a very long time mentally and physically. And, but I know on the other side of it now, all these years later, I'm so much stronger. I have such a better relationship with myself. And, I really feel like I learned how to care for myself. And, I learned some really cool techniques. Like I have a, daily mindfulness practice now that I didn't have before. I learned how to do biofeedback, and biofeedback was really what helped me to learn how to regulate my blood pressure so that I could get off of all those medications that I had to be on for several months after they were born. And I'm, no longer on any of the blood pressure medicines and have a normal, healthy blood pressure now. So, and I really credit that to, the self-care and really diving into it. And I would always say I don't have time for that, but when your body starts to fail, you have to find the time, and that was the thing. That was what really pushed me over the edge, because I would always see myself as a person who really, would do yoga or meditation, or I would teach clients about it. But myself, I didn't have a daily practice. But then when my body sort of said, you better get one, that's when I really started to learn how to do that. But I think, I think there's a lot of really good mom chat networks out there. And I still credit like Pam. I mean, I'm so grateful. If there's one person that you can call, like, a medical professional, if you have a question, or your doctor or a nurse or someone. But I really do credit that moment. I'll never forget coming up to you in my kitchen and being like, something's really wrong. And you knew kind of right away what to do. And I felt cared for. And I felt like, okay, I'm just going to do what I can here, and I'm going to listen to her. Because, but I think having that person, when you have those little questions in the back of your mind, is really important to be able to not push them away, but to ask those questions.
And I think
So
all of us as moms, we just have to get better at caring for ourselves. And that's so hard to do, especially when you have a new baby or even your kids are grown. You kind of always put yourself on the back burner. And,
yeah.
People just don't think of, new moms as people that, are in danger of possibly fatal things happening to them. And this is, 2020, and there should
Yeah.
not be the things happening to moms that are still happening. And,
Mm-hmm.
I know it's a lot of lack of education, because even, as a postpartum nurse, we were never taught to teach moms, when you go home, look for this for preeclampsia, look for this for a uterine infection. There was so much other things to teach. helping with breastfeeding and infant care, that, you know, when I think back on all my years of nursing, you know, I think, you know, I always just assumed that that was a conversation that the doctors had with moms, you know, of the medical things to look for. And, you know, now obviously your situation certainly opened my eyes to different, you know, different aspect of it, and trying to get the message out there, you know, to try and get a support group and try and know ahead of time, you know, what to look out for. And, you know, I would love to be a nurse that just goes to someone's house the day after they deliver, and when they come home, and, you know, just have laminated signs. Okay, if this happens, you know,
That's a
just
checklist.
tell them and check them, because, you know, I just believe in 2020, the things that happen to moms after birth should not be happening anymore. And
Right.
so, you know, we just have to find a way to get that education out there. And, you know, talking with moms that have gone through the experience, you know, I think it just brings a humanity to it, because, you know, we wrote a book, and we, you know, doing an online class and talking about it. But I think until you really talk to and see a real woman that has gone through it and struggled through it, and, you know, at points was very dangerous, that it doesn't seem real. You know, that's not
Very
something
true.
that's going to happen to me, you know, like we think about everything. So I'm just so very, very grateful that you took the time to come on here. And I think that, you know, we're going to be able to help a lot of moms and
I think so.
parents, and, you know, just know what to look for when you get home, and let other people help you. You know, we all want to be super moms, especially someone I know. um, and you know, it's okay to ask for help. It's okay to say you're not feeling right, and, you know, we don't have to be Wonder Woman. And I
That's right.
think that's hopefully going to sink in, I hope.
I
um,
think it will. You know what? And the majority of the time, it's not something that comes up for people. But when you're armed with knowledge, you kind of know what to do. There's a calmness that starts to take over in a situation where you're like, okay, I know what this could be. I have some steps that I can take, and I'm just going to go ahead and do it. And I think being armed with knowledge is always really important, you know. And I think that, I mean, we all read all about the baby, so we know every possible scenario. But I think we forget to kind of think about ourselves in those moments. So I think it's just that bringing those two together will be a really important combination.
Yes.
So,
So we just have to keep sharing it with moms until everybody knows.
yep.
And, you know, just be there for each other, and, you know,
Right.
support each other as women, as new moms, as grandmas.
Yeah.
Um, and, you know, just be there for each other. Like, I know you are always there for lots of other women and lots of people in general. And we're very grateful for that. And, you know, it's wonderful, a wonderful job that I have to get to know wonderful people like you.
Yes. And I'm
So,
so happy you're out there educating moms and parents and families. And I mean, it's so crucial and important. I mean, I mean, you will always have the most special place in my heart because of everything that we learned from you. And I think that that knowledge, being able to make it accessible to as many people as possible is huge. So
yeah.
it's incredible.
Well, I'll keep talking. 'Cause everybody knows I love to talk. But thank
Oh,
you so much, Katie. Please take
thank
care
you.
of yourself and give everyone big hugs for me. And
I will.
I hope to see you soon.
Thank you.
Stay safe and stay well. And I love you
Thank you.
guys, and be careful, okay? Thank
Okay.
you.
Thank you. Bye bye.